So I'm Erin Lukoss, and I'm the CEO at the Bucks County Opportunity Council. We are the community action agency for Bucks County. That's the anti-poverty organization. We're part of a national organization called the Community Action Partnership with over 1,000 community action agencies across the country. So every county has an anti-poverty organization. Did everybody know that?
No.
So that's pretty typical and something that community action is trying to change. They have not done a real good job of branding as one organization, and instead have really focused on solutions at the local level, which we want to continue to focus on those local level solutions, but understand that we're a network and that we're pretty powerful. We have a lot of ability to make changes within our community. So our approach to ending poverty is pretty simple at the Opportunity Council. We have an economic self-sufficiency program, and it really is just an individualized approach to supporting people as they make their way out of poverty. It's not a cookie cutter approach. We really try to meet people where they are and provide the supports that are necessary to help them move forward. That is pretty different than some of the typical safety net programs that are available, the welfare to work programs that are available that are really focused on just getting a job. We're really focused on a career pathway, on helping someone achieve the skills that they need so that they can support their family themselves. We have graduated over 300 families from that program, and that is about 1,000 people who have permanently left poverty. So they typically increase the average. When they start with us, they're earning about $10,000 a year. Many are earning zero, but the average is about $10,000 a year, and when they leave us, they're averaging around $46,000 a year. So, and there's a variety of career pathways that people choose. We don't choose for them. They choose based on their skills and their abilities and assessments that we do to help them move forward. Our whole focus is just making sure that someone has the supports in place so that they can move forward. And some of the things that graduates achieve at BCOC is employment at a family sustaining wage, which I think you all that resonates with everyone. Really important for us to focus on. 78% are Caucasian and 10% are African American. 21% of households in poverty are female head of household compared to 3% male head of household in poverty. So most of the people that we work with are in fact women, but we also work with men, and so I just want to make sure that everyone understands people in poverty are people in poverty. We're working with anybody to help them move forward. So some of the things that we see at the Opportunity Council are when women are the sole caregiver of children, child care is essential to employment, and the wait lists are long and have unrealistic requirements, like they must have a job before they can get on the wait list, but to have a job you have to have childcare, and so it's really a catch-22 for people where they'll look to and find somebody maybe that is less than desirable to watch their children while they get that job so they can get on the wait list. Through our emergency services programs, which we do a lot of emergency services for housing and utility assistance and a variety of things, but we see a lot of women who are facing eviction. They've lost their job or they're at risk of losing their vehicle because of a lack of reliable childcare. That is probably the number one theme of why people lose their job is they had unreliable childcare. And so they called out of work one too many times and lost that job. I already talked about people getting fired and leaving work because they had to. The school calls and they don't have anyone to go to. So those are some of the things that are facing our low income or our women with low income in our county. And then the other thing is that women are often limited in their job choices based on available childcare. So if there's not, if they're looking for something as a nurse, they want they'll often be asked to work the 12-hour shift, but it's an overnight shift, and there's not really reliable overnight shifts unless you have a family member or a friend who's willing to watch your kid overnight, which is a pretty big ask, I think. And so often we'll find people that will take a lesser job just because they can't find that reliable childcare. Some of the advocacy areas that we would like to see, of course, are affordable, flexible childcare for all, or options. Paid sick leave for all workers, that is also a reason why people get fired, because they have to leave when they don't have the hours and they don't have paid sick leave. Increased minimum wage, but I would agree that increased minimum wage would increase in human service dollars to support that, because that is going to be a really tough nut to crack without the money to fill it. And then pathways to living wage jobs that include supports for training and advancement. So I'm going to just give you a little story about Holly. Holly was a young stay-at-home mom, married to a man who worked full-time and took care of their family. But he became addicted to prescription pain medications when he got hurt at work. And then he lost several jobs, and eventually Holly decided to leave him. And she took her daughter and moved in with a friend, and they were doubled up and identified as unofficially homeless. Because when you are, the federal government does not determine that you are homeless unless you are literally on the street or in the shelter. If you are couch surfing, staying with a friend, you're not homeless and therefore not eligible for some of the federal housing programs that are available. Did everybody know that? No. Yeah. So the definition is pretty strict, and our friends at FSA can agree with that. It's pretty strict. So if you don't meet that federal definition on the street or in an emergency shelter, you do not qualify for housing services, for many of the housing services that are available in the county. So Holly had no income except for child support, and that was when he was able to pay it, because he was facing addiction and therefore was not reliably working, I should say. So she really relied on SNAP benefits and his child support to help get her through. Holly was taking a bus. She had no reliable transportation. She was taking a bus 2 hours each way to go to work and take her child to childcare. So she enrolled in our self-sufficiency program and started attending Bucks County Community College to become a registered nurse. We helped her get a car, so we gave her a donated car through our Wheels to Work program, and that was really the game changer for her. That reliable transportation helped her cut 4 hours off of her day and able to help her get to the classes that she needed to get to and also get to work. So we supported her with housing assistance, transportation, scholarships, and gift cards to meet her basic needs so that she could feel empowered to do school. She had the ability to do school, but without those supports in place, she could not succeed. So today, Holly is self-sufficient. She's graduating from our self-sufficiency program in 2 weeks. And she's working as a nurse. She is at a major hospital, and she's supporting her family free of government subsidy. She no longer needs those supports. Now, she is wanting to give back. We're going to tell her to work on her family and herself for the next year and come back to us next year and maybe become a board member at the Opportunity Council. But those are some of the things that are the biggest challenges for people in poverty in our county.
Excellent. Thank you.